to meet you here. During today's short lesson, I will explain briefly about the blood pressure. Now, blood pressure is closely related to our physical health, so we need to regularly measure our blood pressure to keep it under the normal range. Now, a lot of people nowadays suffer from high blood pressure, which could further trigger a series of health problems such as heart disease and stroke. So it's really risky if we don't control it. So first, let's have a look about the blood pressure definition. Now, blood pressure is the pressure actually exerted by the blood on your artery wall. We know that the blood vessels can be divided into artery and veins. Now, normally inside the artery, the blood exerts higher pressure, and inside the vein, the blood exerts lower pressure. So the pressure inside our artery is called the blood pressure that we normally measure. The blood pressure has two readings, one on the top, another one on the bottom. The top reading is called the systolic blood pressure, and the bottom reading is called the diastolic blood pressure. Now, systolic blood pressure measures the pressure in the artery when the heart starts to contract. Now, we know that when the heart starts to contract, the two ventricles will squeeze the blood out. And from the left ventricle, the blood will be squeezed out into this aorta, which is the big artery, and then sent through the other arteries to the rest of the body. So when the heart starts to pump, to contract, now the pressure inside the artery is also high. So this pressure is called the systolic blood pressure. Now, diastolic blood pressure means the pressure inside the artery when the heart starts to relax. So when the heart actually, after pumping, it will relax, and then the blood will refill back to these two ventricles. Now, when the blood refill, the pressure inside the artery will also drop, and that pressure is called the diastolic pressure. So that's why the diastolic pressure is always lower than the systolic blood pressure. Now, then let's talk about the range. The normal blood pressure, the systolic blood pressure normal range should be between 100 to 130, and diastolic blood pressure normal range should be between 60 to 90. Now, if your blood pressure falls into this range, then that's normal, and you don't need to take action. Now, if your blood pressure actually is out of this range, then you need to pay more attention. Now, then let's have a look about abnormal readings. If your blood pressure actually is higher than systolic level is higher than 140, and diastolic is actually higher than 90, then we can call it hypertension. Hypertension. So hypertension means high blood pressure. Now the systolic, now we focus more on the systolic and we pay less attention to diastolic, and systolic is actually more important than diastolic. So if systolic is above 140, it's a hypertension. That means it's really risky. You have to receive more treatments. Why hypertension is risky? Think about our artery. Now, if the pressure inside your artery is really high, the blood exerts high pressure on this artery wall. Now, the artery wall is made of the layers, which is called the endothelium. Now, this layer actually, if always there's a high pressure exerted on this artery wall, it will damage these layers, the artery wall. It will damage it and make it become really weak. And in the long run, it could cause serious issues. If it becomes weak, it could burst and it could be damaged. So the blood circulation will be cut off. So hypertension really is risky. Now, if the blood pressure, actually systolic blood pressure, is between 130 to 140 but hasn't reached 140, then we call it pre-hypertension. Pre-hypertension. So pre-hypertension means that your blood pressure is high, but it's not that high. So it is not hypertension, but you have to pay more attention and take extra caution because it is risky. It could further develop into hypertension. So if your systolic blood pressure again is between 130 to 140, please take action to control it. So this is high blood pressure. Now, if your blood pressure is low, and then we can call it hypotension. Hypotension. So hyper means high, hypo means low. So if your blood pressure is low, that means hypotension. What is hypotension? If your systolic blood pressure is below 100, that is normally low. That's normally low. Now normally what causes hypotension, especially the one very common reason is that you don't drink enough water. If you don't drink enough water, you have less blood volume. If the blood volume inside this artery pipe is less, then there will be less pressure exerted on the wall, and then you will feel dizzy, tired, no energy, sleepy, lethargy, all these things. So if your blood pressure is below 100 systolic, now the first action you should take is make sure you drink enough water to increase your blood volume. Now a lot of young people, actually their blood pressure is low and even lower than 100. So many young people, especially the people with slim body shape, now their blood pressure could be between 90 to 100 systolic between 90 to 100. And this is also fine for young people and especially the people with slim body, because when people are young, the blood vessel is really is also young and very healthy. And when people actually get older, normally the blood pressure also gradually increases, because when people get older, this endothelium of the artery, the layers will be slowly damaged because of the wear and tear. When this get damaged, actually it could cause a resistance, and the blood artery wall could become narrow and very stiff and make this blood pressure increase. So normally when people actually getting older, their blood pressure also increase. Now when people are young, normally the blood pressure is a bit low. And also different people has different blood pressure. Now everyone has their own baseline. So this is only the general reading, but when we measure a person's blood pressure, we have to really compare the current reading with his or her baseline. So every person is different. Some people naturally have a low blood pressure, and some people naturally have a high blood pressure. It could be caused by the family history, by the gene, so that's why we have to consider this person's own circumstances. Okay, then after we talk about the range, now again, if your blood pressure is systolic, if the systolic blood pressure actually is below 90, and that is a bit more risky, that's really low actually, then you probably, if you feel dizzy as well, and you probably need to seek doctor's advice. Now we're going to talk about the factors which could trigger the hypertension. The factors trigger hypertension. Now, normally hypertension, high blood pressure is more risky than hypotension. So we rather have a hypotension and we don't want a hypertension. Hypertension causes so many health issues. Think about if you always have high pressure inside the artery and the artery wall, the layers will constantly get damaged and get stiff, narrowed, and it could really restrict the blood circulation and cause a lot of further problems. So we really should control the blood pressure under the normal range. If your blood pressure is higher than 130, you should take actions. So what things could make your blood pressure high? Now the first thing we just mentioned is the age. The age. Like we said, because when people get older, because of the wear and tear, especially because of the long-term use of these blood vessels, the blood vessel will get slowly damaged and make the blood artery become stiff and narrow. so it can cause a high blood pressure. So age is actually very important reason. Now, secondly, the blood pressure could be increased by the poor diet. The poor diet. Now, diet plays significant role in maintaining the blood pressure. So, what kind of diet could increase your blood pressure? Now, two diets. One is the high cholesterol, and one is a high sodium. So high cholesterol. Now, cholesterol is actually a fatty substance that exists inside your blood. Now, we have actually two types of cholesterol. One is called a high density cholesterol, and one is called a low density cholesterol. Now, actually, high density cholesterol is a good cholesterol, and low density cholesterol is bad cholesterol. Now, when this bad cholesterol actually stays in the blood and accumulate in there, it could form the plaque, and this plaque could stick onto your artery, your blood vessel wall, onto your artery wall, stick there, and make it become narrowed and damaged, So when it becomes narrowed, the blood pressure will then increase. So less blood could be allowed to flow in, and the pressure will be very high. So low density cholesterol, this one is really harmful. Okay. Now, so where this low density cholesterol come from? Now, this cholesterol actually normally come from the food that we consume, especially the food such as the animal products or the fatty food, oily foods. Now, more fat, normally the fat contains more low density cholesterol. So it's really important that we consume less fatty meat and fatty animal products, and consume more healthy food or vegetables and fruits. Now, however, high density cholesterol is a good cholesterol. So high density cholesterol could actually remove this bad cholesterol from your artery and then clear them out from your body. So this is good. So not all the cholesterol are bad. So we remember that low density cholesterol is a bad one, and we should restrict the intake. It normally comes from the fatty food that we consume. Second diet is a high sodium. If you consume high amount of sodium, now sodium, if it stays in your blood, it could actually suck the water out from your body cell, and make your body cell become dehydrated, and then your brain will tell you to drink more water, and the more water actually you drink, the more the blood volume will increase, and the more the blood volume, if it is increased, and then it will exert higher pressure on this artery wall. So when the sodium is high, I said, like it's high inside your blood, okay, the high concentrated sodium could suck the water out from your body cell and make your body cell become dehydrated, and then it will trigger your brain to produce a hormone. This hormone is called the antidiuretic hormone. Now, this hormone will help your body to reserve more fluid, reserve more water, and then you will drink more water as well, and then you won't pass enough urine. And then more water would be, if it is reserved inside your blood, it will actually increase the blood pressure. So to control your blood pressure, a very important thing is to restrict your sodium intake in your diet. Please don't eat too much salt if your blood pressure is high. So low salt. So low fat, low salt. So if you want to keep healthy blood pressure, make sure you have low fat and low salt food. Now, the third reason for the blood pressure to increase is the diabetes. Diabetes is a very serious chronic condition, which means that the blood sugar is high inside your blood. Now, the sugar inside the blood is called the glucose. Now, if the glucose is actually high in the blood, it could also damage the artery, the blood vessel wall, damage the artery endothelium. And also glucose actually could restrict something's release. Now normally your blood vessel will naturally release one substance which is called the nitric oxide. Nitric oxide. Now this nitric oxide could actually relax your blood vessel and make it dilated to ease the blood flow. So this is actually naturally released by the artery endothelium. However, if your blood sugar, the glucose is high, then it could restrict the release of the nitric oxide. It could reduce the nitric oxide, and then it will constrict the artery, make it narrow. So it could long-term diabetes could really increase your blood pressure. Another important reason is the genetic factor. Genetic factor. So another thing, like if the glucose is high, you should also consider to eat the low sugar. So low sugar. So again, when you actually want to control blood pressure, you should remember low fat, low salt, low sugar diet. Now, genetic factor is another reason for high blood pressure. Now, if you have a good diet, you are young and you keep a good lifestyle, but your blood pressure could be still high if you have family members who have the same condition. If you have one or more family members who have hypertension, whose blood pressure is always high, then you have more chance to getting high blood pressure because you could carry that gene. So you probably, when you were born, your blood pressure is just naturally higher than other people because of your family history. So that's another reason. Also, obesity. Obesity could trigger the high blood pressure, so that's why we have to keep the weight, to measure the weight regularly and control the weight. Now, the best way to control weight is do exercise, have enough exercise. And exercise could promote your blood circulation, could make your blood vessel healthy, could reduce the damage. So exercise is actually effective in treating all different types of health issues. Lose weight. Now, these are the common reasons for the hypertension. So actually, blood pressure is really closely related to our health. If you actually, normally if you have a high blood pressure, you actually are most likely asymptomatic, so you won't feel it. You probably don't have any symptoms, you probably feel fine. So it's really important that you actually have your test done like regularly. You need to actually have the health examination to be done every 6 months or every 6 months. Like to have your blood pressure checked. So a good option is that you can buy a automatic blood pressure equipment and to measure your own blood pressure at home. So you don't need to always go to your doctor to do it. It's very simple. You can easily get a blood pressure equipment and then check it at home. And you can buy it from the pharmacy. It just costs you like $30 or $40. You can easily get one and measure your own blood pressure. And it's really important. If you don't measure your blood pressure regularly, you never know whether your blood pressure is high or low. And you'll probably ignore it because normally you don't have any symptoms if your blood pressure is high. So I really hope this little lecture could help you have a little bit more understanding about what is blood pressure and how can we properly manage it. Thank you very much.